Hello, today we'll be going over a central venous line dressing change, and prior to starting any procedure, you want to recite the 7 steps. Number 1 would be to check the physician's order. Number 2 would be to perform hand hygiene. Number 3 would be to organize your equipment, which I've done already. Number 4 would be to identify the patient, introduce yourself, explain the procedure, and then provide patient privacy. I provided patient privacy already, organized my equipment, and I've already performed hand hygiene. So prior to coming in, you just want to identify the patient, which I've done already, and you want to just take a moment to assess the wound site itself and make sure they're not in any pain, right? So you're checking for any irritation, redness, inflammation. Okay, so we'll just bring this up to a nice working height, because then I'm going to start by beginning the central venous line dressing change. Okay. So you just want to inform the patient that since you're going to be working with a sterile field, you need to have them look away, right? You don't want them speaking on it, you don't want them touching it, and you don't want them touching your sterile field, that's for sure. Okay, so now I will just go wash my hands. Okay, that's done. I will open up my central dressing line tray, okay? And you want to make sure that you open it, peeling it from the sides, right? And we're just going to take that out. Discard that waste bag, which I had set up prior to. And we're going to start by opening away, alright? Maintaining that 1-inch margin, having the tray above waist level. We want to put our mask off to the side along with our sterile gloves. Okay? And we continue opening it, right? The blue is not sterile, so we can touch. Remember the 1-inch margin. Okay, and we'll just do the pinching method as well, right? So you just don't want to touch anything not within that 1-inch margin. Now you can take a moment, not reaching over, and adjusting it, making sure you're not going over that 1-inch margin. Okay, now I'll take a moment to put on my mask. Okay, and we're going to put on clean gloves to remove the old dressing. Alright. So, whenever you're removing this, you want to make sure you're anchoring the actual site itself, because you do not want to mess up and dislodge it from its position. Okay, now that that's taken care of, we're going to go on and remove our clean gloves and put on our sterile gloves. Same principle applies. You have the 1-inch margin. Okay. So prior to touching these, you want to make sure you're not using your thumb. Okay. And you have to take into consideration which part is sterile and which part is not. Okay. Now, if you mess up, it's not a big deal, right? You can fix it at the end. Just same concept. You don't want to use your thumb, right? Stretch it out. And obviously they're backwards. It might look a little ridiculous, but it's fine. Take a moment to fix it. Because now you're touching sterile to sterile. It's not dirty to sterile or clean to sterile. Okay. Take a moment. Justin. Okay. Now we would take our ChloraPrep, snap it in place, okay, and begin cleaning. You want to make sure you are doing it in a horizontal, vertical motion, right? Making sure you're getting this. And obviously prior to that, you're checking now since the dressing moves off, see if there's anything else that you can take a moment to look. Any other discoloration or irritation? Okay, you want to lift the wires up, clean underneath them. Same thing, horizontal, vertical, vice versa. Take a moment to clean the wires. Okay. That. We can discard that. And we can begin applying our Tegaderm. Just make sure it's sealed in as tightly as possible so that you can avoid any bacterial growth or anything that can cause infection. Perfect. We'll discard this. Moment. Take our gloves off. Move our mask. And we'll take a moment to just date, put the time and initial. And we will just stick this on so the next nurse coming in will know when it was changed. Alright, we're going to put the patient back comfortably. Adjust their head. And the lower back. And then we're just going to wash our hands, and we're going to document anything that we found that was unusual or anything during our observation or nursing notes.